Hello, this is Dr. Janish, and this video is going to demonstrate the repair of a volar plate for swan neck deformity. Here I'm demonstrating a swan neck deformity in this particular patient. This patient's able to hyperextend at the PIP joint and does create a swan neck deformity when awake and using the hand. Here I'm going to draw out my incision, which is a triangular Brunner style incision. This is going to help with scarring after the surgery heals. A scar from this particular incision does not shorten the joint or keep the joint from fully extending. The volar plate is a ligamentous structure that lives at the proximal and phalangeal joint and does prevent the finger from hyperextending. In this particular patient, it has avulsed or pulled off of the bone. I'm elevating a flap here and retracting that back, being careful not to devascularize it. This is the digital nerve and artery that I'm pointing out with the scissors. I will enter the flexor tendon system by opening the pulley at the level of the A3 pulley, and we'll protect that for later repair. I then tie down the flap that I've created, allowing my assistant to have a free hand. Dissecting down, just retracting the flexor tendons out of the way, you can see the volar plate here coming into view. It is avulsed off of the proximal phalanx and quite loose. We'll use a 69 beaver blade to free up some attachments on the lateral aspects of this flap, allowing me to get exposure to the bone below. We'll prepare the bone below with a 69 beaver blade, removing some of the fibrinous tissue. This allows for a good landing spot on the bone. Here I'll demonstrate the area where the ligament will be tied back down into the proximal phalanx, which is now clean and ready for reattachment. This drill is making a hole for the suture anchor that I'll be using. I use a micro Mitek suture anchor. There's the hole, and it is ready for the anchor to be placed. This is a micro Mitek anchor. You can see at the tip there. This is a tiny little piece of metal that is deployed by this device and has a suture that's attached to it in the handle. With one little pop, the anchor is deployed nicely. And prior to removing the handle, I will free the suture that is attached to the anchor now in the bone. This suture with 2 needles on the ends will be used to suture down the volar plate, which is being retracted here. Suturing down the volar plate back to its landing spot on the proximal phalanx. This needs to be tensioned appropriately so that the finger does not hyperextend, but is also not too tight. That's the difficult portion of this particular part of the surgery. Here, testing the repair, the finger does extend to 0 degrees and no more, and it is quite stable. I like to put in a couple additional reinforcement sutures along the sides of the volar plate, being extremely careful to protect the digital nerve and artery right next to this. I'll irrigate out the wound with saline as usual, and repair the pulley system with 4-0 monocrol suture. Now that the pulley system is repaired, I'm going to close the skin with a layered closure. The first suture is a 4-0 monocrol on the subcuticular tissue. I place a few of those, and then a running 5-0 nylon in a horizontal mattress style suture that is running. You'll notice that the wound edges are everted, which means sticking up and puckered. This is very much on purpose and creates a much better wound scar after healing is complete. After the sutures are removed, that does flatten out and the wound looks very nice. Here I'm testing the finger to make sure that the repair is solid. The finger does straighten to 0 degrees. I don't want to push that too much, but it is getting tight at this point and flexes nicely. This is the end of this repair, and thanks for watching.